Because I've only been given 10 minutes and I've had up to 2 hours to give this talk before, I'm going to try to power through. And I'll start off with the take-away messages. So the take-home messages is, if you can, use an interpreter, use the refugee health pathways, and consider contacting our community refugee health team for support. So their email is there, but it's also on the health pathway. So if you take those away, that'd be great. Working in refugee health, usually the question that I get the most is, where have people come from? Sorry, is it Paul?
You go ahead.
Okay. And so you'll see here, I've put a map together of people come in the last 4 years. And so in red are the countries of origin. So those are the countries that people have fled from. In yellow are the host countries, which are places where people have fled to, waiting to come to their third country, and people can wait there for decades sometimes before they come to New Zealand. And in orange are the countries which happen to be both countries of origin, where people have fled from, and also countries where people have fled to while they're waiting to come to us. And so how do refugees come through to New Zealand? So I've covered the different pathways of everyone who we think is coming in New Zealand recently. The top 4 will be covered in a lot of detail on the refugee health pathway as well. But for the refugee quota program, so we agreed to take 1,500 people every year through the quota program, and they come through the Refugee Health Centre, and so we look after them and we do their screening. Refugee family support, they're people who've been, who have family here, so refugees who've sponsored their families over. There's up to 600 places a year. I don't think we've been meeting that in recent times, but these people won't have had any screening, so they would be reliant on you to consider screening for them. Since 2021, there's this great community organisation sponsorship program, which started as a pilot and is now a regular thing, which allows community organisations to apply to Immigration New Zealand to be sponsors, and they're able to then sponsor people over and to support them in their first couple of years of resettlement. And it's about 50 people per year who come through this way. Again, they haven't had full screening, and so you'd be considered screening for them. Asylum seekers come in as people who come to New Zealand and then ask for asylum while they're here. And then convention refugees are people who've had their asylum accepted, and so they become convention refugees. In the community at the moment, we've got people who have come through recently through a couple of special pathways. So there's a residence pathway for Afghan evacuees, which started in 2021. Just over 1,500 people came that way. And at that time, because it was COVID, there was definitely TB screening, but they may have had limited other screening, and they're now in the communities under all your care. And also there's a special Ukraine visa in 2022. Initially, those were work visas and student visas, but as of March this year, there's been a process where now they can convert those to residence visas. And so there's just over 1,300 adults on the work visas and just over 300 children or young people on the study visas who are having those converted. Now, they came here so quickly that there was no TB requirement for that particular group, so they haven't had any screening, including TB screening. And they're in the communities that we're looking after now. So our service is based at Te Araru Moai or Aotearoa, or a safe haven in New Zealand. It was formerly known as a Mangere Refugee Resettlement Service. And we take in 7 groups of 220 people through the year. They stay with us for 5 weeks, and health is just one part of the program. And so we have a service, but alongside us, there's an education program run by AUT. And Immigration New Zealand also run a program where they find them homes, they link them into MSD for their benefits, they set them up for banking. And also there is Refugees as Survivors, which is a great NGO who provides mental health and wellbeing services on site. And also we're really lucky in Auckland, they have a service in Auckland that you can refer to in Onehunga as well. In terms of what our service do, we look after them from the moment they land through to when they come out to you. The refugees who come through the quota program, they do get some offshore screening already, so we get a handover of notes from the offshore screening. We then do completion of screening, we manage their cares with us, we start them on their vaccination catch-ups, or we complete them if they've been started offshore. And then before they leave, we sit them down, we make sure they understand what's happened to them from a health perspective, but also what they might expect in the health system, including 15-minute GP appointments, and also to ask for interpreters when they book appointments and to book well ahead of time. And then we hand them over to you and we do the referrals in the community. And I guess from all our learning, and I know it's difficult in the community, but one of the key things really from our perspective is it's really useful to use an interpreter if you can. It's very tough for walk-in appointments, but you should all be able to access for booked appointments an interpreter. There is a there is a health pathway for that, the Interpreter Services Health Pathway. So have a look and talk to your PHO about how you might better book an interpreter for your booked appointments for these refugee patients. I'd also like to shout out to eCalled, who have some really great modules that they do on working with interpreters and also working with refugee patients. You can do them online or you can ask to do them in person, but they're free and they're really good for learning as to how to use interpreters appropriately and also, some of the challenges maybe working with refugee patients. Health pathways, I'm very excited that as of July this year, we have 3 new refugee health pathways on the Auckland Health Pathways. So there's a screening one. There's one on adults, there's one on children and adolescents. We've also done quite a big upgrade to the Migrant and Refugee Services page, so there's a lot more resources you can get into there. There's a Ukrainian immigrants and tuberculosis one, because there is some funding around tuberculosis screening for that group. So if you still have people who haven't had TB screening in that group, they can access some funding still for that until next year, as far as I know at the moment. And then there's the interpreter services that I've talked about. I guess the refugee health screening page, who's it for? Pretty much for everyone I've talked about who hadn't been screened before would be worth considering. Some people have thought that maybe migrants and refugee-like background, you may not want to offer them full screening, but there may be components that could be really useful for you. It has things to consider that maybe you wouldn't ordinarily consider first off in normal primary practice. So we talk about micronutrient and vitamin deficiencies, some infectious disease exposures, also some cultural practices. So we have a little bit about female genital mutilation, and FGM actually has its own pathway, so you can link from that into its own pathways, how you manage that and what supports you might better get to. From a screening perspective, we get quite a lot of contact for people, who've come to the meeting, what screening investigation should we do? The screening we do, tuberculosis, intestinal parasites, infectious serology, all the deficiencies and baseline, thalassemia, that's all on the pathway. So go and have a look. And if you're not sure, when you've got someone in front of you, the tests are all there, which is really good. I guess a few fun things inside the pathway that aren't hard to find because it's quite a big, long pathway is that there's quite a lot of patient information that's translated that it can be really helpful. So we get a lot of the material comes from Health Translations, which is actually based in Victoria in Australia, but it's very applicable to here. What's really good about their translations is that they have an English version, which I have up there for a couple of conditions, but then they have them in multiple languages as well. And so you can look on the pathway under vitamin D, for instance, for the patient handout, or you can just scroll down to the bottom if you want to look at what's available, and Health Translations should be at the bottom. Same for the New Zealand health system, just if they don't have a good understanding of the health system. This information's on Healthify actually, but it's in the body of the pathway and it's also at the bottom under patient information if you're just looking for that. One really good resource that we're linked to, I thought I'd talk to about more closely, is EasyDose. So we have quite a few patients who are either pre-literate or pre-numerate, so they don't have the numbers or the letters to really understand how to take medications. It can be quite a challenge. So what I've done here is I've used EasyDose, very easy to use, and I've made up a script for John Smith, who I've decided to start on Flexitide. And what's really good about that is it shows you sort of the timing of when you might be taking your things. It's got the colour of the medication in the case of the inhaler. It's got how you take it. So it's quite a easy thing to use very quickly to be able to print out and give to somebody. This is how you take what you need. For the refugee health and children's and adolescents pathway, look, anyone in their first few years of being here could be useful to go to this page. We have lots of stuff about the vitamins and things, and also about some of the hematological conditions they might have, like G6PD, that you can link off to great information about. But actually what I think is really useful on the pathway, and which I couldn't get stayed open on the front of the pathway, is a syndrome-based approach. So you'll need to scroll down into the pathway and find syndromes-based approach, but if you click on the table, what it does is it brings up this table, which gives you a presentation And what it does is that, it says this is what they've come with, so in this case, fever. What are the common causes? Because the truth of it is that they'll mostly have the common causes. But also it comes up, okay, well, what else might you want to think about in this group? And for the ones who haven't been screened, for instance, they may have not had MMRs, and so they may be at higher risk of measles. They may be in a country where they may have been exposed to dengue, so just things to think about. And also then it links you off to the related pathways and guidelines. So if they're within health pathways, or linked to that pathway. But what we've done here, for instance, in fever returning travellers, that pathway is helpful to a degree, but if you want something specific children, there's also a link to the Starship fever and returning travellers pathway as well. For adults, there's a few things I wanted to talk to, but there's a really good section in there about pregnancy. So there's things in pregnancy that we wouldn't necessarily consider in ordinary pregnancy around thiamine in particular, which for people who come from countries with rice-based diets where there really isn't much variety, they can be at risk of thiamine deficiency, which is a high risk for them, but also a high risk for their babies. And so it's important to think about that in pregnancy. There's some good stuff there about trauma. Links off to the PTSD pathway, and we're quite lucky here in Auckland we have a PTSD pathway, and a little bit talking about somatising presentations as well. Again, for adults, there is a syndromes-based approach table. You still have to find it and click on it, but it is a really useful table to use. For the Migrant and Refugee Services health pathway, like I say, there is a lot more resources in there, and we've tried to put them in a way that's relatively logical, but you still need to click on the group, if you like, to figure out what's in there. So for instance, here in Support and Community Services, there's a Community and Representation section. It's a big section, so I've just taken a wee snippet of it. But what's really good about that is if you have somebody from a refugee or migrant community who feels a bit disconnected, who might just want to link into someone in the community or, some groups, there's some good ideas there. So, the ones I might call out here is Mix It, for instance. They provide opportunities for young people from refugee, migrant and local backgrounds to get involved in creative projects. So they're very cool, based out in West Auckland. And so if you have young people who might want to be connected, that could be a good option. We've also called out things here like the New Zealand Ethnic Women's Trust, there's Rainbow Haven. So there's lots of groups that you can link people into that you could look for in there. So if you have time, have a wee look as to what resources might be there for you. Community Refugee Health Team, it's a great team. We really only had them up and running for 2 years. There's 2 nurses now that we've got. Recent one only started maybe a month ago, and also a senior social worker. It's a really great team, and what they do is they visit quota refugee families 4 to 6 weeks after they have resettled, and they check their access to appropriate health, social services. If the linkages are taking time to set up or not sure, they will stay with them for a while until they're really linked in. The team are a real good resource of knowledge. Yes, they work mostly with quota refugees, but if you have other questions, even if they can't directly give you help, they're certainly able to point you in the right direction. So know of the stress, know that they exist.